Dr. Agbor Ebuta is the VP Medical Initiative for Africa, and he joins me on World Now. Thank you so much for joining us on World Now. Talk to us about China's zero COVID.
Thank you. Welcome, Nigerians.
Yeah, thank you. Talk to us about China's zero COVID U-turn and how it has affected the country's virus response.
Okay, thanks for having me. The zero policy by the Chinese government, led by the Chinese Communist Party, is a policy that aims to achieve minimum infection rate, transmission rate, and prevalence rate for COVID. That policy has been in place essentially for 3 years because the Chinese reaction, Public Health Department reaction to COVID was that we need to stop transmission and maintain it at zero level. Unfortunately, what that has meant is that you have had large swaths of lockdown because it means that any patient that tests positive to COVID is quarantined. Everybody that has been in contact with that patient is tracked and traced, and if they are positive, they are quarantined. If a whole street, you have several people positive there, the street is put on lockdown. If a local government, a state, or a region, you have a significant number of cases, that area is put on lockdown. And the lockdown by the Chinese government is a no-joke lockdown. It shuts down the mobility, it shuts down utility facilities and all of those operational things that makes life significantly meaningful. And in addition to that, what it also means that you cut down interaction between people, and therefore the chances of natural infection promoting natural immunity is reduced. But the Chinese government believed that while this was going on, they went ahead to vaccinate patients, vaccinate their population, and they achieved a high population vaccination with almost 90% in most areas. However, the vaccine that was used was the locally produced Chinese vaccine, which was not based on the new technology that is driven by gene-based scientific adjustments of RNA. That is the messenger RNA. The common examples are the Pfizer and the Moderna. So what the Chinese government did was that they put everybody on lockdown and achieve zero policy. In that period, only 16,000 people died out of a population of 1.4 billion people, as opposed to some countries in the West that had up to 1 million deaths. So even as near as November, the Chinese government celebrated that as an outstanding medical feat, so to speak. Unfortunately, because of the fire outbreak due to quarantine and the death and all of that and the protests, the Chinese government decided to put away that policy. Unfortunately, that change was too abrupt. What it meant was that people were now free to move around, and transmission rates have gone up critically. In fact, there's been a surge, and there's a pressure on the Chinese health system. The reason why that surge is significant as opposed to what we expect is because a lot of people do not have natural immunity. A lot of people have only been vaccinated with the Chinese version of the vaccine, which is not as effective as the messenger RNA. So you expect that illness, admissions in ICU care, severe diseases are on higher rate. That's why in the Chinese, in China, you've had a significant surge. And the other challenge again is that as infections are as prevalence of infection is rising, the virus is at a higher chance of mutating, producing
Dr. Ebuta, let me jump in.
Can have implication for global public health.
Right, let me jump in your thoughts. The issue of zero COVID and the lockdown and all of that have actually sparked a lot of protest in China, where the protesters are calling for Xi Jinping's resignation. One is not sure whether this would fly in a country as China, because it's a very dangerous thing to call for the resignation of, to call publicly rather for a resignation. Do you think anything would change if Xi Jinping steps down? If indeed he's going to step down?
Well, we must commend the Chinese. They had a robust reaction to COVID. They had one of the best screening system. They had one of the widest vaccination program. But the problem is that the transition time was too short. If you compare this to to what Singapore did. Singapore also had a zero COVID policy. But after that policy was reviewed, they had a transition time of 6 months to 12 months, during which period some of those lockdown restrictions were gradually relaxed. And vaccination with messenger RNA, especially in elderly people who are the susceptible population, was increased. And so most people were getting up to 2 or 3 shots, which is what is protective. So in the case of China, I do not expect any improvement in the situation.
Absolutely.
It may even get worse, because here you have a leader who has been in charge, and he's using a certain policy, and now he has reviewed the policy. The lessons
Definitely,
from
most
the
definitely, because of our time,
will be useful for the new policy. So it's going to be an addition. So I think the Chinese will make a mistake if Xi Jinping is forced to step down. What they need to do is view what their failures are, what was responsible for those failures, and what they should do going forward.
Dr. Agbor Ebuta, I know there's a lot, there's a real lot to talk about, especially as regards COVID-19, and then the fact that we also having to record new cases in Nigeria. But then we have to leave it there. The Vice President, Medical Initiative for Africa, Dr. Agbor Ebuta, thank you so much for your time. Thank you.